Hi, everybody. Welcome to another edition of Business Matters, the Broomfield Chamber of Commerce video podcast. I'm Pat Monticelli. Thanks for joining us for this edition. We have a great interview today set up with Jason Vahling, who's the director of Broomfield Public Health. We're going to be talking about the state of COVID-19 in Broomfield and some of what we're dealing with locally and how that's affecting all of us in this community. So, Jason, thanks for taking time to be with us today.
I appreciate it, Pat, and it's always a pleasure to join the Broomfield Chamber of Commerce. Tim Taylor and I are good friends, and I know how much our business community means to Broomfield, and also with my dad being a small business owner growing up with his own hardwood floor company, I can totally appreciate what it's like owning your own business and running it. So thank you for the invite and the opportunity to be with everybody today.
Of course, our pleasure. We want to dive right into what's going on. So let's talk a little bit about the state of the pandemic in Broomfield, what our numbers look like. What do we look like right now in Broomfield?
Yeah, so we as a city and county, we're doing a really good job after the stay-at-home order and up to the stay-at-home order. We all saw the significant increases in cases in March and April, which led the region and the state to take measures to implement stay-at-home. But as we moved into safer at home in the great outdoors, we saw a decrease in cases. Unfortunately, what we're seeing now is a slight uptick in cases, and that's happening in the state, it's happening in the region, and it's specifically happening here in Broomfield. Over the weekend, the state did see some decreases in cases and hospitalizations, and also in the region. We haven't seen that yet in Broomfield over the last couple of days, but again, that data is ever changing. So I guess to summarize, the state and Broomfield, we're trending in the right direction. We're seeing a uptick, which is very concerning to us in cases, and we want to take this opportunity to reverse the trend and see those cases go back down. Our ultimate North Star is to prevent community transmission to the point where we don't overwhelm our hospital capacity. And the Colorado School of Public Health has predicted that if we stay below 55% social distancing, we could potentially exceed our hospital bed capacity in the fall.
Right. So with the, you mentioned the uptick, and we've seen the slight uptick numbers that you referenced. Even given that, what is the feeling? Are we, as a Broomfield community, are we on the right track overall? Are we losing ground? What's kind of the general feeling about where we are right now?
Yeah, I would say what we're seeing is through our mobility data, as we have reopened our economy, we're seeing more people obviously going to work, and we're seeing more people taking vacations and doing other things that are more social. And that has led to then cases coming back and us seeing increased household transmission. And that's what's concerning to us is as we reopen, obviously, and doing it in a smart and thoughtful way, we need to get back to the basics of the 3 W's, which is to wear your mask, wash your hands, and watch your distance. And that's what we're really encouraging people right now is, even though we're operating in this place of having a variance and our cases are slightly going up, we want to remind people that let's go back to the basics. If we all do those things, we could reduce the transmission in the community. And I think the most important thing that we're trying to do is to set ourselves up for success. So I think sometimes I often hear, well, I don't know anybody who has had COVID, so why should I be concerned about this? And what we have to think about is, yes, it may not be you, but if somebody else gets COVID in the community and they expose others, and they can expose, at one point during the height, it was up to 5 or 6 people, and then you multiply that out by the spread. That's what generates the community spread, and it really makes it difficult for us to be able to manage the virus as much as possible. And the other thing that we're really trying to do as a community, is get to a point where we're able to manage this virus and not have to go backwards to those physical distancing measures that were in place. And so if we can all, again, our Broomfield residents and our businesses step up and remember those basics, and limit your gatherings with others right now, that's where we can make the biggest difference.
And I would imagine that if the numbers start to go in the wrong direction, and you mentioned the variances that we have, those could be taken away if the numbers start to go up more significantly. Is that correct?
That's correct. So yes, Broomfield currently has a variance, and then when we submitted the variance, we were looking at multiple areas, but those were covered through the state order. The only one that stayed in place in our variance was for gyms, that they could operate up to 50% capacity versus the 25% capacity that the state requires. And so with our cases increasing that we're seeing, we received a letter from the Colorado Department of Public Health and Environment saying we needed to submit a mitigation plan, which we've done. And now we're in communications with CDPHE on the impact to our variance. And they have indicated they would work through us through that variance process. But ultimately, to answer your question, yes, if things start to head back in the wrong direction and we see a significant increase in cases, and by that I mean that we see our doubling time, that cases are increasing on that slope so quickly that it's getting out of control, that's when we have to take more of those preventative measures around physical distancing.
And so to keep that from happening, I assume it's one of the reasons that the city and county put their reverse the trend initiative into place to help us get back in the right direction. So tell me a little bit about what that involves, and and again, the genesis behind that idea.
Yeah, so it really is the fact that we are going back to the basics, and the reverse the trend gets us back to those basics, that we're reminding our public that we need everybody, our business community, our faith community, sports community, residents, everybody to play a part in this. And so we want to see those numbers head in the opposite direction. And in order for us to do that, we need to take some key crucial steps, which, as I was mentioning before, is making sure that you're wearing your mask when in public. And the state order says you have to wear a mask indoors, and Broomfield has a similar order, but we always recommend as a public health agency, if you can't maintain physical distancing when you're outdoors, it's always a good practice to wear a mask. Second thing is washing your hands, and that good hygiene, making sure that you're doing that within your home and your household, and cleaning down and disinfecting. The third thing is maintaining that social distancing. So again, if you're going to a friend's house or a family member's house for a party, trying to limit that to below 10 people, and if at all possible, do it outdoors. Try and maintain that social distancing between you. And then another important piece is when we talk about physical distancing, it's important to remember our mental health. And so by no means does physical distancing mean we have to go isolate ourselves from the entire world. There's still ways that we're finding new ways to connect with individuals through technology. And, I'm on the phone every night FaceTiming my parents, and now they're learning actually how to do it on an iPhone, which was quite the experience for them, but they enjoy it. They love it. They get to see my face. I get to see their face, and they get to see their grandkids. So yeah, that's the main message to our community is we can get there. We can reverse the trend on these cases, and it takes all of us to go back to those basics.
Absolutely. Now, talking about those mitigation efforts, of course, the mask mandate is a big part of that. And Broomfield had passed a mask ordinance, which then the state followed, of course, a day or two later. Have you had any feedback or anecdotal evidence or anything like that? How is Broomfield responding in general to the mask ordinance as far as from what you've seen?
Yeah, so we have our a complaint line for people to send to us any complaints they may have around masks. And additionally, we have our environmental health staff that are already out doing their normal business, restaurant inspections and so forth. And they're looking and observing what's going on. And what we've seen overall is compliance from the community with the face covering or mask order. And I wouldn't expect anything less from Broomfield. It's been important, I think, because the message that we were trying to deliver when we were discussing this with our Board of Health is we don't want to have to go back to those strict physical distancing measures. One of the best preventative measures we have, and the science is really backing it now, is wearing those face coverings. And if we could put that in place and we get the vast majority of our community to do that, we fully expect to see our cases and our trends heading in the right direction.
If we do get back in the right direction, which of course we all hope we do, but let's not say if, let's say when we get those cases reduced and start to head back in that right direction, what is the next step forward for our community as far as restrictions and openings and things like that? We get to a certain level, what's the next progressive step forward?
Yeah, so there's really 3 phases that the state of Colorado has put in place, and one was stay at home. The second one is safer at home, and the third phase is protect our neighbor, which further opens up and expands what you can do as a community. And you have to meet certain metrics to get there, to show that you have the testing capacity, you have the epidemiology capacity, that your hospital beds, you have the hospital beds, ICU bed capacity, PPE capacity, and also community transmission. And so if we do see our cases start to head in the right direction, we're meeting the metrics for everything else as far as protect our neighbor as a city and county. So it's really getting that community transmission and cases down, and that would get us to the point of being able to go to the state and be able to say we believe we qualify for protect our neighbor, which would open up more. The one caution I would say with this virus that I've noticed over the first 6 months of working through this is it's unpredictable. So, as much as we try to predict what the future is going to hold for us, what we see is it's all dependent on human behavior and what's really taking place. And so we might put all of the best measures in place, but if we start to see that we get to protect our neighbor and then we have outbreaks in certain places, then we would have to revisit that. So that's one of the challenges with this virus is the virus, I like to say, manages us more than our ability to manage it because it knows no boundaries and behaves the way it does.
Do you have a sense of, because you mentioned, the PPE and hospital capacity being part of that, being able to move to the protect your neighbor phase. Do you have a sense of where we are as far as available PPE, as far as hospital capacity right here in Broomfield?
Yeah, so actually we're doing really well in that area in Broomfield, and We're part of, it's called the North Central region because we share hospital systems with other counties. So the latest information we had on PPE, and I want to make sure I get it absolutely correct, is our ICU and ventilator availability has remained relatively stable since July. And our medical surge bed availability continues to slowly decline as hospitals continue pre-COVID operations. So basically what we're saying is that we have sufficient ICU bed capacity, and we also have sufficient PPE at this point in time. I would say the thing that has been concerning me the most over the last 3 weeks has been the lag in testing results. And this is a national issue that now hit the state of Colorado and is also hitting us locally. And the issue is we have private labs that as you go and get your nasal swab, they send it off to a lab. And so when we're seeing this surge of cases happening across the country, they're sending their samples to the same labs. And we're getting to a point of delays in testing up between 5 days. We heard at some points it was up to 10 days. And from a public health perspective, that's really challenging when you have the delay in lab capacity, because we cannot do our traditional public health measures, which is immediately as we get the results, contacting that person that has been diagnosed with COVID, and then also following up with all of their contacts to make sure they're quarantining.
So, but that again is not something that the solution to that problem is not necessarily a local solution, something that has to be handled, I assume, on a larger basis.
Correct. And so that's one thing we do as a metro area and as a state is we've been heavily involved in pushing the state on what can we do to build up that capacity, that testing capacity, so that we're not so reliant on the federal government. I think that's one of the challenges, obviously, with this virus is we're all part of one overall system. So, all the states are interrelated, and then you also have the federal government, state government, and local government, and there's so much interplay between all of those.
But again, we go back to circle back around.
Uh-huh.
Really, it sounds like it's going okay, a slight uptick, but if we want to move to that next level of being open, it really comes back to individual responsibility on preventing a transmission.
Correct. Yes, that's the way I would summarize it. Is we went in a very positive direction. We're seeing this increase in cases, and we want to reverse that. And if we have every individual out there that is doing those 3 basic things of, again, wearing your mask, washing your hands, and hygiene, and watching your distance, maintaining that physical distancing, and limiting your interactions with people right now, I feel like Broomfield definitely is in a good place.
And I think the message, of course, also is to stay vigilant. Even if you start to see things start to decrease, it's not a time to relax.
Correct. And I think one important thing for us to think about as we move into the fall season is that in addition to having COVID, we also have our typical flu season, cold season, and on top of that, we have school districts that are now defining what it looks like to have students either do online learning, a hybrid approach, or some in-person classroom activities. And so at this point in time, again, Broomfield, with a slight uptick in cases and being able to reverse that trend, we want to monitor that in the fall. And like you said, stay really vigilant, because if we start to see community transmission, or the best advice I could give people right now is get your flu shot this fall. That way we can rule out at least flu-like symptoms because the symptoms are so interrelated.
Well, Jason, again, we appreciate you taking time to talk with us today. This has been very informative, and I think gives us a really good picture of where we are right now. So thank you for your time.
Thanks, Pat. And as I said before, I just want to really send a big thank you to the business community. I know how difficult and challenging this has been for the business community and also the employees. And so I just want to send out a heartfelt thank you to all of you, and especially what you guys do as the Chamber of Commerce for Broomfield.
We appreciate that, and we truly are all in this together. We'll get through this together.
Yeah, we will.
Jason, thanks again so much. We appreciate it.
Great. Thanks, Pat.
Thanks again for joining us for this edition of Business Matters. Some of the links and resources we mentioned in today's podcast will be included in the notes section of this YouTube video. We'd also love to connect with you on our social media. Here are all the ways you can do that on Facebook, Twitter, Instagram, and LinkedIn. We hope to be able to interact with you there. Until next time, I'm Pat Monticelli for Business Matters.